Hello there, sweet one. Today we are ditching the white coat to talk about your acne scarring. I am an actual physician, as you know, but we've met here in this secret world between worlds, and so nothing that I say can be interpreted as actual medical advice, because you and I have never met in the not this world. But it's going to be fun, it's going to be relaxing, and for the sake of that relaxation is why we're ditching the white coat, because it stresses me the F out. I like to maybe be able to help you out as well. So, actually, let's go ahead and hand sanitize, and I'll go ahead and touch your face, kind of look a little bit at the scars, and see what we can do, and kind of talk about what the dermatologist might do if we can get you a specialized referral, okay? So we'll do that first. But go ahead and tell me, just tell me again your name, date of birth. Just make sure we got the right person here. Medic didn't put me into the wrong room. That's happened once or twice. I've gone into the wrong room, but I always, check to see that we're talking about the right thing. So I've never revealed anyone's medical information by accident. I'm just going to touch my hair a little bit before I wash my hands and touch you. I know the sound of hair is really relaxing. I don't know why. I think it's because we all have good memories that we associate with our family members. So, a little bit of sanitizer spray. I know it smells good. You want some? Okay. Alright, don't forget to rub your hands together. Well, here in the world between worlds, a lot of things can be a lot of different things. So yes, it is what you think it is. It's a very exclusive special hand sanitizing spray. Costs $80 and is only available to my top visitors. No, but for real, today we're going to take good care of you. Let me just listen to your heart and lungs, okay? We'll do things a little bit out of order, just because I know you find it relaxing. Alright? And because I would like to hear what your heart sounds like. Ideally, this is something that would happen every visit. But a lot of physicians don't have time to really listen to their patients. Deep breaths. All right. I'm going to take a quick look to your lungs in the back. Deep breath. So I listened in 4 spots. For like a full, crazy, complete lung exam, that'll be more like, you can listen to 12 spots is what I like to do for like somebody who's hospitalized and I'm worried about their lungs. For a quick visit where we're going to focus on your face today, this is just to make sure, with all the weird stuff that's going around, your lungs are clear, your heart is good, and we're good to go. Although I guess I can't discern whether or not your heart is good. You might be a very evil and terrible person, who knows? Just like me. Alright, let's get fingers on and start poking around. How long have you had acne for, my dear? Alright. And what medications have you tried? I see. Do you use any over-the-counter creams, herbals, something like that? I won't judge you, I promise. You really should tell your doctor any herbals or alternatives you use, even if your doctor isn't open to those things. A lot of times we've been trained in what are the dangerous parts of those things, which is good. You definitely, sorry, my hair is really bothering me. It's growing out. I'm going to get really long and there's going to be a big blue streak in it. It's going to be fantastic. It used to be down to my waist, but I cut it for the military. So, alright. Sorry. as I was saying, you should always tell your doctor about the herbals or other things you might be taking, different creams, even if they're like special makeup creams from, who knows, Mary Kay, Shiseido, whatever, because we've been trained in the things that are dangerous about them. Exactly. Alright, that makes sense. Alright, let me go ahead and touch your face now, my dear. I see a little bit there. Okay. And then here. I see. Okay. This one's a little bit runny. It's a little gooey from your face. Are you hurting? Does that hurt? No? Okay. Well, it's okay. I'll get new gloves. Don't worry about it. It's not embarrassing. People's faces make, things come out sometimes. It's okay. You don't need to be embarrassed about it. I think that we as societies have kind of forgotten what it means to be human. And a big part of being human, we're angel and animal. We've got these amazing big frontal cortex, like spiritual type selves and thoughts, but we also have this bag of chemicals that oozes sometimes, and it's okay. So yeah, you got a little bit of gunk on my glove from your little thing there, and that's what the gloves are for. And honestly, I think that tells me something. It's very sensitive. Does it hurt? But it doesn't hurt? Okay. Alright. The reason this is valuable is there's different kinds of acne. There's nodular cystic acne, there's inflammatory acne, basically dependent on different, well, it's dependent on different, the mechanism of the way acne is created. So acne happens on your face, not because you ate peanut butter, and how dare you eat peanut butter, but because first mechanism, there's some kind of bacteria on your skin. And this bacteria, basically the acne bacteria, normally doesn't cause problems for people, but it can in the context of the other two responses of your skin. And so your body is trying to fight this little bacteria that likes to pocket itself up and hide in little pockets, which obviously that makes sense when you start thinking about the pustules, blackheads, whiteheads, the different little bumps that you start to get. So there's two kinds of little bumps that you sometimes see with acne, a pustule versus a papule. A papule is the one that's completely covered. Usually you see it in like nodular cystic acne. It seems hard almost, and it doesn't have like goo in the middle of it. A pustule has that goo, the ones that you squeeze and pop. The papules, like sometimes they just won't, like it seems like they won't pop or they'll hurt a lot. Those are the ones that I find so unsatisfying because everybody likes to pop them. That's a good question, actually. You can, for really large nasty like cysts or big like the bigger acne bumps that are pustular, you can ask your physician to lance it. They can, under sterile conditions, and get it out for you. I'm sorry. Was that a bad sound? I'm very sorry. I'm very realistic and down to earth about these kind of things. So that's just how I am. But human body doesn't gross me out. It amazes me, and I find it wonderful and beautiful. So I can be very direct. That's why people come to me for their marriage and bed help as well. It's a thing that I was very good at when I was more actively working with the military, because I am still in the military, but I'm not actively seeing military patients right now. And erectile dysfunction and other kinds of stuff fairly common in the military, for understandably. And none of these things are weird or strange to me. Anything you can come up with, I have probably come up with something more strange. So don't be embarrassed about your body. It's just a way that your body is responding. It's this wonderful scientific process. It's part of who you are, and it's fantastic. I'm going to take these gloves off so I can mess with my hair, because I am also human and I need grooming. Absolutely, no, you're right. So, as I was saying, the first kind of acne trigger is going to be that little bacteria that lives on your skin. The second trigger is going to be your inflammatory response, where your skin will sometimes decide that it wants to build piles and piles and piles of squamous skin cells on top of where the bacteria is. That's where you get the bumps. That's where you can sometimes get the really uncomfortable red inflammation. The inflammatory response there is because of cytokines. Those are little chemicals that draw attention to the area, basically bring and invite other cells there to attack any bacteria that might be there. The problem is that the body is kind of fighting itself, right? Because any time that the stuff wants to get in there to kill bacteria, you've got these big piles of squamous skin cells in the way that have been built up and built up and built up, right? Exactly, it's a problem. So in order to deal with that, what we do is we basically, there's some medications or chemicals that work to stop that inflammation. A lot of them are based on like vitamin A. It's to kind of peel away those layers. And then there's other medications that work more focused on trying to kill the bacteria. Absolutely. Let me just on my computer here write down a little bit of what you've told me so that we have everything, squared away. I don't want to be missing anything. I don't want to forget anything that you're doing. How's your family? Oh, I'm sorry to hear that. It's like that sometimes. Sometimes it's hard to understand why life does what it does. Yeah. That I understand. Yeah. They shouldn't have been that way with you. But you can understand how in their position. Yeah. It's good that you're able to put yourself in the position of the other person. That's pretty mature. That's pretty impressive. That's, I think that's actually a DBT technique. I'm not sure. We should go over some DBT stuff together at some point. Oh, absolutely, yeah. Well, so the other factors, right, and it's actually 4, not 3. The other factors that I usually tell people about are increased sebum production by the glands because of different androgen hormones. That's why you see boys usually get it, or women, right, when we're reaching puberty. We've got more of the androgens is the boy hormones, right? Testosterone, dihydrotestosterone, all those different things, right? Yeah, basically the things that lead to secondary sex characteristics, so forth. Well, women have them too. Everybody has it. It's part of being a complete human being. It's having a little bit of both. Yeah. That's just the biology of it. So the androgens that you have as they start building up more during puberty or teenagehood, and sometimes some of us have more androgens throughout most of our life. We're all different, right? We're all special in our own way. Those things start to tell your skin to produce more sebum, which is like gunk. Another one, sorry, I'm still making sure that I have your data right here. Another one is going to be, we already talked about the extra skin cells, right? The extra squamous skin cells that are left there, they die and they leave a lot of keratin. Yeah. We talked about the Propionibacterium acnes, and we talked about the inflammatory reaction. So, there's basically different schools of thought. A lot of times for a very simple acne, we'll start with what's called benzoyl peroxide, which you can even actually get in some full strengths over the counter. Yeah, absolutely. Well, usually the prescription strength is going to be a little stronger. But you can still, that doesn't mean you can't get it over the counter. And sometimes, I think depending on where you are, you can get a pretty good strength. And what you can do sometimes is you can do both the benzoyl peroxide plus the, basically a retinoid, that was what I was talking about, the vitamin A's, plus that wash. And you can do that wash at night. Yep, the benzoyl peroxide wash in the morning. Oh, that's a good question. Yeah, after you wash your face is fine. So before you do your makeup routine, one thing that may help actually with the acne is stopping or changing your makeup routine, and making sure when you go to bed you don't leave the makeup on, which is something that I have been known to do because I didn't wear makeup at all until I was well into my almost 30s. So I don't do a lot of makeup, and well, I do a lot of makeup now for these visits with you, obviously, but I do it very rarely, maybe once a week, and so I tend to not bother to take it off, which is very bad. If you have acne, that's not a good move. So don't be like me if you have acne. So that's how you use the benzoyl peroxide wash. Yep. Well, of course I'm a little nervous being in the presence of somebody as important and wonderful as you. Yep, so I'm like fiddling with my hair, looking here and there. I don't know. You are such a precious and wonderful person, and I don't know if you know this, but, you know, people are saying some good things about you in the ether, in this, you know, realm. Well, yeah. Maybe not people that you know. Somebody here loves you. You are special, and I just feel that. I feel how loved and special you are, and it makes me a little bit fluttery and shy just to be around you. I think you don't realize also how beautiful you are. Like, being around you makes me feel a little bit anxious and uncomfortable just because you're so pretty. Oh, and handsome. I mean, just all your features are very you. And there's, I don't know. I know that like acne can make you feel uncomfortable. I've had a lot of patients with bad acne. My husband has like scarring acne, and I think he's really, really hot still. He's so hot that like I like him even though that gender is not normally my type. Right? How you know, love conquers all things. Love sees what you really are and not these dumb things that you worry about yourself, that people who don't know you might have a problem with. I don't know. It's hard to explain. I sound silly when I'm trying to explain these things. But in all honesty, I don't know, your beauty is special. So the acne is more, you know, it's not, you know, don't want you to be uncomfortable. I want you to be able to embrace this self-image or the physical image that you would like to have, while still recognizing the wonder of your natural biology. You know, the wonder of the fact that your body knows how to interact in all these different ways, and maybe it made a little slip up and put on too much keratin. Silly body. It was just trying to take care of you. It was doing its best, right? It's embracing these treatments with love and care instead of with I hate my face, make it go away. Which is, I think we all feel that way sometimes. I feel that way very strongly about some parts of my body that I would like to change. But we are what we are, you know? And part of being human is loving and accepting that, even while we try to make it better. Because there are things also that, you know, could be detrimental to your health, or, you know, that you would like to, you know, that small changes that make you feel better. And that's okay. Make you suffer less. There are some big changes that I would recommend against because they're unhealthy, and it depends on the person. There are some people who have really bad folliculitis because of shaving too much. Those people should not shave. One of the big problems I've had in the military is a lot of my African American patients, they're like the way that their hair is growing, it can be harmful for them to be shaving all the time. So sometimes they'll get I'll write a shaving profile for them so they don't get these terrible inflammatory bumps. Because the problem is that the way the hair grows, it'll circle back into itself if you shave it too tightly. And then that causes infections and pain and irritation, and that actually doesn't help their warfighter goal. You know, it's hard to focus on shooting the guy you need to shoot when your face is like itching and hurting and bothering you and blah blah blah. Obviously you have to do what you have to do, but in those cases a well-trimmed beard is much healthier. So in those cases I will say, don't shave the beard that God gave you because it's bad for your health. Everyone is an individual. So all that to say, different treatments work for different people. If the first acne treatment doesn't work for you, we can try another one. There are options. You have many, many, many options. So benzoyl peroxide is the first line. Sometimes we'll start with both benzoyl peroxide and tretinoin at the same time. Benzoyl peroxide in the morning, a soft tretinoin wash in the afternoon. Let me type a little bit more here. I lost my... Sometimes these electronic medical records will delete everything that you have done. We use one in the military called ALTA, AHLTA. And when that crashes, you are screwed. And you might lose a patient's entire record. It's terrible. It's really terrible. Well, because the contractors are competing for the lowest work, for the most money, and the people who are evaluating the contracts are not experts, right? They don't have a computer scientist evaluate the contract. They have some colonel up at the top evaluate the contract. So that's the problem, at least for that one. And they didn't worry about testing individual users towards the end, right? The best products focus on how to make a simple user interface work with their powerful programming background. And that requires testing the interface with the customer. So what they should have done is taken, 200 physicians, military physicians, since it was supposed to be a military product, and tested the EMR with them. They did no such thing. I don't know a single military physician who was happy with the ALTA program. The older DOS program works much faster. There's this like black and white programming program that we use to enter orders called CHCS, and that, like from 1982, works better than the more recent ALTA that they made for us. Yes. I know, sometimes I just talk. I can make visits shorter if you want. You can see less of me, or you can just choose somebody else. But I like having you here. Like I said, being in your presence is an honor and a privilege. Absolutely. Well, if tretinoin doesn't work, I like to move next to something like clindamycin, right? A topical antibiotic, especially if it's like moderately inflammatory and so forth. You can use erythromycin. I've never done that. I've always done the topical clindamycin. So I just think that it's, you don't have to worry about allergic reactions, better for, resistance and things like that. Oh, do you? Oh, I would appreciate that. Oh, yeah. Yeah, I would love your card. Card. Not your car. I don't want your car. I'm trying to get rid of mine. If you want to buy it, let me know. I need less cars for the, for the environment. We really only need one car. We don't need one car per person. We can figure out our stuff. I know I'm a little bit of a weirdo activist, but one car should be enough. Yes. So I've always used clindamycin, and you just put it on. Same thing you can do it in the evening as well. Now, if you go to the dermatologist, they may give you different recommendations, and those are going to be tailored towards you. Do what the dermatologist tells you to do, okay? I'm not a dermatologist. I'm a generalist. I've treated a lot of acne, but your dermatologist is going to be the one who's got the expertise. They're going to have examined you in their way, right? Well, usually I would only take like a sample or skin scraping if I thought you looked like you had something else, like a fungal infection, a cancer, something else like that. Like that little bleeding bump there, if that had been there for a long time, right? Because you told me that just popped up this morning. If that's been there a long time, changed in color, grown, and it just kind of oozes, then I would be concerned that we need to get, like a skin cancer biopsy, things like that. You worry about skin cancers when things change in size, okay? Change in color over a long period of time. Those are kind of big hints for like melanoma type stuff. They tend to be like, kind of look like a brown mole, but it'll be like a mole that changes. It'll like turn purple or it'll widen. That's concerning. Yeah, oozing less so, but you can always have it looked at. There are some dermatology sites where you can actually submit your image online and they can look at it. I think that's pretty neat. A lot of telemedicine applications for dermatology because they don't always need to touch you. Sometimes they just need to look at you. Well, dermatologists are it's one of the most coveted specialties actually in medicine because their schedules are really good. It's really calm. They don't have to do like call or some of the other things most of the time that other physicians have to do. So it's a very coveted specialty. You usually have to have very high board scores to be a dermatologist because nobody will let you be a dermatologist. Because again, best schedule. You might work a couple days a week and make the same that a physician who works every day a week works. Yep. So what would be a good retinoid? Adapalene is best tolerated. I use tretinoin the most because it's what's usually available in the military hospitals. But adapalene, tretinoin, either of those is good. Absolutely, yeah. Now, if things don't get better after that first dose of 2, there's another thing you can do too, is that you can have the topical retinoid, the topical benzoyl peroxide, and then an oral antibiotic instead. Doxycycline is very popular for that. I did write about doxycycline in the latest Healer to the Heroes. Yeah, that's the podcast about the science fiction of like, where do superheroes get their medical care? Yes, doxycycline features very prominently in the last episode about the shapeshifter. Yeah, how would you medically treat a shapeshifter? I think that's a fun question. Or how would you do surgery on an invisible woman for like an emergency? Oh yeah, I love these kind of weird questions. But yes, doxycycline. You can take 100 milligrams. 100 milligrams twice a day is usually what we use for like a major infection. Just 100 milligrams a day is fine for acne. But again, get your particular dosage, because I don't know if you're a really tiny person, really a giant monster. Get your particular dosage. Like me, I'm a very large woman. when I stand next to people, it makes me feel like an ogre or an orc. I could be, but like not the little orcs, like the big ones, the uruk-hai. Uruk-hai. Isn't that a tingly word? Uruk-hai. I feel like an uruk-hai when I stand next to some of my tiny soldier patients. So if you're a big giant monster like me, maybe you need a different dose. Probably not, but you might. Dosages are usually calculated based on a 70 kilogram male. That can be a problem for certain estimates. There was a study about car accidents, right, that found that in the same kind of collision, women were more likely to die. So, because the standard crash dummy is a male who kind of fits a certain profile as far as his weight is concerned. So he's a larger, more solid person. So smaller women, as far as like how they built safety standards or how cars were built, were more likely to die. Which part of that, it comes into question, what if we could test safety in cars using two crash dummies, right? One that is also female and smaller, and kind of have those two estimates, to better study the physics and the mechanics of the car crash when we were trying to test and build automobiles, right? So that's one solution. It is tough because there's all different shapes and sizes. You can extrapolate it to where it's like, oh my goodness, we need a crash dummy for every possible. Obviously, there's always going to be greater force is going to hurt smaller people more. So to some extent, there's nothing you can do about it. But to another extent, having a female smaller crash dummy would be ideal to help preventing female mortality, right? So it's difficult to find the best study model because in real life, every single human being is completely different. All studies are some kind of extrapolation, some kind of generalization, right? That's why we have to be very specific when we're reporting study results. It's like in this population, we found this, right? So we can kind of extrapolate, and that's what all medicine is. All medicine is me saying, well, these things have worked for these people. This is where the studies are. But that's not necessarily what might work for you because every individual is different. In, the wonderful science fiction future, it would be ideal to have everybody's genotype and know exactly what medication is going to work for their genotype. In my medical school, they were already pioneering a psych medication genotype where they would try to determine which psych medications to give to people by genotype, because then they could avoid the worst side effects of some of these psych medications. So that's kind of cool, isn't it? And it's like trying to target. So that we're not there yet, right? That's going to cost a lot of money. But the best we can do is what has worked, right, for the most people in specific populations. So again, that's why some of medicine is kind of a scientific trial and error. We try this first. If that doesn't work, we step up to the next thing. And what we always try to start with is the least invasive or least harmful solution. Yeah, exactly. So the next step after that, if you didn't get better after about 2 months, would be the, like a doxycycline, the topical retinoid, the topical benzoyl peroxide. If that hasn't worked, and we've tried all these different combinations, that's usually, especially for someone with really severe cystic acne, really inflammatory, it's really making their life difficult, the way other people treat them, making their life difficult as far as work. That's where I'll usually send someone to the dermatologist for isotretinoin. Generalists can prescribe isotretinoin, however, we have to have a special certificate, and I don't have mine yet. So most of the time, most generalists and even most family medicine specialists, internal medicine, won't prescribe isotretinoin because it's such a dangerous medication. You can't get pregnant on it because there will be significant side effects and deformities for the fetus. Both males and females who are on it have to regularly have labs checked to watch their liver function, kidney function, watch their blood cells, make sure that nothing bad is happening. because it can have some pretty serious side effects. So a lot of times people will not feel comfortable prescribing it. They will have a dermatologist prescribe it. So that's usually when I send someone to the dermatologist. But it's not really worth it because most of the places I want to work are not going to have them. You're not going to have isotretinoin in the jungle in Paraguay. You're going to be using those other medications, which are incidentally a lot cheaper. Doxycycline especially is a lot cheaper. So I don't know if it's worth it for me to get a certificate in something that I'm never going to really use. So, but we'll see. We'll see how the future goes. So if you need that, I would send you to a dermatologist. And I would recommend, if you've tried all of those things before, that you talk to your doctor about getting you to a dermatologist. And yeah, it can be tough in the insurance world, but if you can prove that you've used all of those things, they can't really, it would be a little bit weird for them to turn you down. Alright, I am just about done entering your stuff. It's a lot of clicky buttons here, but everything's in. So, I have your record in, we've done your exam, we've talked about treatment options. I think, yeah, absolutely. I think that's going to be the best for you. Well, I appreciate you. I appreciate you gracing me with your presence. So, thank you. Well, and I hope you can rest. I hope that meeting your dream doctor in this dream world help you sleep well, and then in the morning when you wake up you can go to your actual doctor in your world and it'll help you out. So, alright. Well, sleep well, dear one. And again, it's an honor to be in your